Good afternoon, everyone. I am Jaira May and Aguarin, your nurse for today. So for today, I'm going to assess the gowning and gloving. So for assessment, you need to review the client's record or discuss with the client other healthcare team member exactly what procedure will be performed that requires a gown and gloves. And then the rationale for that, ensure the appropriate of the procedure will needs of the client. And then check for the presence of patient allergy to latex to prevent the risk of developing allergy or allergic reaction. And then for the planning, of course, I need to prepare the materials that will be needed. Of course, prepare the materials needed for the procedure, sterile pack containing sterile gown, which is I have in here. Sterile gloves, always have an extra pair of this gloves available. And then hand covering or hood, and then surgical mask. And also I need to organize the materials to facilitate the perform of the procedure. So I don't have surgical mask here. So I'm just going to improvise.
So for the implementation, first perform through surgical scrub to remove debris and transient microorganisms from the hands and forearms, reducing the residual microbial count and leaving an antimicrobial residue on the skin to prevent growth of microorganisms for several hours. Number 2, wear a surgical head cover or hood and ensure that all hair and facial hair, including sideburns, are covered to prevent hair dandruff and microorganisms from falling onto the sterile field. Placing the head covers first reduces the risk of contamination falling onto the scrub clothing. Number 3, put on a surgical mask. Ensure that the mask covers the mouth and nose completely. Mold the malleable metal strip on the top of the mask to the nose to reduce the dispersal of microbial droplets from mouth and nasopharynx. Number 4, open the sterile gown and gloves on a flat surface away from the sterile back table. 5. Grasp the sterile gown at the neckline, lift up and away from the field. The exposed side effect folded is inside of the gown to avoid risk contamination from unsterile surfaces. 6. Step back into an area where the gown can be unfolded. 7. Hold the gown with both hands on each side of the neckline, allowing the gown unfold fully with this inside toward the wearer. Do not shake the gown open. This causes air current which could lead us to contamination. Number 8, keep arm at shoulder level and away from the body as you slide both arms into the sleeves, stopping when the hands reach the proximal edges of the cuff. Don't push the hands past the cuff. This will not allow you to perform the close gloving technique. 9. Ask the circulating and sterile nurse to touch the inside of the gown, shoulders, and sides to bring it over the shoulders. This part of the gown is considered a non-sterile, which can only be touched by unsterile personnel. Number 10, secure the neckline of the inner gown tie at the waist. This should be done before close gloving to keep the gown from flapping and becoming contaminated against non-sterile surface. 11, return to the sterile field created by the gown wrapper to pull on sterile gloves. 12, keeping hand inside the gown sleeves. Open the glove wrapper. Avoid getting too close to the sterile field. This is because the 1 to 2.54 cm margin of this gown wrapper is considered unsterile. 13. With the non-dominant hands still inside the gown sleeve, pick up the gloves for the dominant hand. Extend the forearm of dominant hand palm side up. Place the gloves for the dominant hand palm side down with the fingers facing toward the elbow. Grasp the glove cuff through the sleeve so it keep the non-dominant hands still inside the gown sleeve when picking up the gloves for the dominant hand because hands are considered unsterile and only sterile surface or outside part of the gown shall touch the sterile glove. 15. Use the non-dominant hand to grasp that side of the glove. Cut off glove cuff. Stretch it over the hand covering the wrist entirely. 16. Advance the gown cuff down toward the wrist. Direct finger into the glove and adjust glove on hand. To secure the gloves into the hands, to facilitate comfortable performance during the surgical procedure. 17. Repeat the procedure for the other hand to complete the close gloving procedure, observing sterile technique. Then fold hands together and interlace finger to have fingers fully extended into the gloves. 419. Ask the coworker to hold the waist tie of your gown using a sterile glove on a sterile forceps or drape. And last, to make a 3/4 turn, then take the tie and secure it in front of the gown. Another technique is asking your coworker to take the 2 up ties on each side of the gown and tie them at the back of the gown, making sure that your uniform is completely covered. So this approach keep the ties sterile.
So for the evaluation of that, you need to document all the procedure that you do, or note the sterile technique that being used in the performance of the procedure to keep a reward, or to keep a record for the referral and community of care. And then you need to ensure also the adequate members of the sterile supplies are available for the healthcare procedure or providers to promote the organized system of setting sterile materials for efficient delivery care.